Hi, I'm Nina from Avid Property Group and welcome to another episode of AVIDEngage. Today we're in this stunning Newport 41 Fairhaven Homes display home and I'm joined by St John Ambulance Victoria.
Hi, I'm Marge. I'm the Community Development and Engagement Officer at St John, and we are so excited to be working with Avid in order to bring you some of these life-saving tips and tricks.
Cardiac arrest can happen to anyone at any time, so it's important community members know what to do. Today we're going to teach you the vital steps to know what to do if you find someone on the ground who looks unwell. Cardiac arrest occurs when the heart stops beating effectively, preventing blood flow to the brain and vital organs. If not treated immediately, it can be life-threatening. But by taking the right actions, we can help to save a life. CPR and defibrillation are two life-saving actions that need to occur when someone isn't breathing and unconscious. These two actions, when done together, can increase someone's chance of survival by up to 70%. The doctor's ABCD action plan is a simple plan that you can follow in an emergency to help you remember what to do. Let's break it down. D is for danger. In this step, we want to check the area is safe. It is really important you keep yourself safe so you can continue to help. Some dangers that you might find is cars or traffic if you're near a road, electrical hazards, fire or gas, or sharp objects. Make sure you keep yourself safe so you can continue to help. Our next letter is R for response. We want to see if the person can respond to us. The first way we do that is by using our voice. We can ask them to wake up or call their name if we know it. If you are not getting a response after that, we are then going to squeeze their shoulders. We want this to be painful to try and wake them up. If they are not responding, this is an urgent emergency and we need to send for help. The next letter is S, send for help. We need to call 000 or your local emergency service to get the emergency services on the way. Be prepared to tell them your exact location, what has happened, and answer any questions they might have about what has happened. If there are other people around, get them to help you out. You don't need to do everything on your own. Get someone else to call 000 for you. And if there's a first aid kit or a defibrillator around, go and get them to grab those for you. A first aid kit is really important if there's any injuries you need to treat, and a defibrillator is an essential device that is needed if someone is having a cardiac arrest. And remember, local businesses may have a defibrillator that you can use. If you have someone there, go get them to fetch it for you. Our next step is A for airway. We need to make sure there aren't any blockages in the airway, as this can stop the person from breathing effectively. So the first thing we're going to do is open up that person's mouth and have a look inside. Some things that you might find in there are food, vomit, or even loose dentures. We're just looking for anything that shouldn't be there. If we do find something in there, we need to roll that person onto their side into the recovery position. From here, we open up their mouth and tilt their head down slightly to allow whatever is in there to fall out. Once we have done that and the airway is clear, we want to open up the airway. We do that by tilting the head slightly backwards to allow that airway to be clear and open. Our next step is B for breathing. We need to check if they are breathing to know what kind of help they need next. We use a technique called look, listen, and feel, which helps us to check for breathing. We first look at their chest to see the rise and fall of their chest. We then listen to their breathing sounds. If we hear any irregular sounds or gasping, they may still need urgent help. We also put our cheek to their mouth and nose to feel breathing. If you hear gasping or irregular sounds, it is always better to start CPR. Don't hesitate. So if our patient isn't breathing, we need to move on to our next step, which is C for CPR. You may also hear of it as compressions. CPR is simple. We just need to follow a few steps. Place the person on their back if they aren't already, and gently tilt their head back. You can do this by placing one hand on their forehead and the other under the chin. Gently lift the chin to open the airway. Place the heel of one hand on the center of their chest, on the lower part of the sternum. Place your other hand on top and interlock your fingers. Keep your arms straight and press down hard and fast, about 1/3 of the depth of the chest. This will be more than 5 centimeters for an adult. Perform your compressions at a rate of 100 to 120 per minute. This is almost 2 per second. After 30 compressions, give 2 rescue breaths if trained to do so. Continue to give compressions and rescue breaths, if you are willing, until help arrives. Push hard and fast. Don't stop until help arrives. In an emergency, if you don't feel comfortable doing breaths, you don't need to. Just continue compressions. Remember, any attempt at CPR is a good one. It doesn't have to be perfect, but we are trying to save lives, so have a go. The next step is D for defibrillation, also known as a defib or an AED. If you have access to one, use it. They are really simple to use, and the voice prompts will guide you through using them. And make sure you continue your compressions. Cardiac arrest can happen unexpectedly, but with the simple tools we've given you today, you can help to save a life. Remember your doctor's ABCD action plan, how to do CPR, and when to use a defibrillator. It's never too late to learn, so have a go and save a life. For more tips and training, visit the St. John Ambulance Victoria website.